welcome back to our Fire Nursing tutorial YouTube channel. In this class, I am going to explain in detail regarding hydrocephalus. It is very important. Don't skip the video. Watch till the end. And don't even forget to subscribe. We'll see hydrocephalus. It is one of the neurological defect. Here, hydro is different word and then cephalus is a different word. Hydro, cephalus. Hydro means, hydro refers to water. Water means which kind of water here? Here CSF. That is cerebrospinal fluid. Hydro refers to water. Water is nothing but here in hydrocephalus. Water refers to CSF, that is cerebrospinal fluid. And now we'll see cephalus. Cephalus means brain. Inside the brain, fair, that is ventricles. In ventricles, there is a irregular cavity in the cerebrum. In ventricles, there is an irregular cavity in the cerebrum. Next, what happens here in the sense? Ventricles. There are 4 ventricles. There are 4 ventricles. Here first and second is a right lateral ventricle and left lateral ventricle. Right lateral ventricle and then left lateral ventricle. Here 2 ventricles. Ventricles. Thus, 2 ventricles are going to communicate with the 3rd ventricle. Third ventricle. This one is the 3rd ventricle. Through the interventricular foramina. Those 2 lateral ventricles are going to join, going to communicate with the 3rd ventricle through the interventricular foramina. And what happens here next in the sense, 3rd ventricle is going to communicate with the 4th ventricle. It is going to communicate with the 4th ventricle through the duct. That duct name is cerebral aqueduct. Here this one is the 3rd ventricle and then this one is the 4th ventricle. Here this one is the middle foramina and these 2 are the lateral foramina. Was the lateral foramina. What happens here in the sense, in the ventricles there will be the lining layer will be present on these ventricles. This line will be present. This line is nothing but this is called choroid plexus. named as choroid plexus. This is responsible for the production of CSF. Many times this question was asked in competitive exams like Aiims and JIPMER. That is, which organ or which part is responsible for the production of CSF? That is, production of CSF by the choroid plexus. Here CSF will be produced, and then that CSF is going to communicate to the third ventricle through the interventricular foramina, and then third ventricle to the fourth ventricle it goes through the duct, that is cerebral aqueduct. Here there are three foramina. One is the medial foramina and then two are the lateral foramina. Here what happens in the sense, CSF from here medial foramina it going to reach and present in the subarachnoid space through the meninges. Through the meninges, that is present in the subarachnoid space. Then where it is subarachnoid space, that is present in between the arachnoid matter and the pia matter. If you want to understand clearly in the sense, last year I had done the class on meningitis. You can see that one, you can watch that one, you can study, and after that you can study hydrocephalus. If you have any doubts regarding the meninges and that layers, I have explained in detail in the topic of meningitis. You can see that. And then here CSF will be produced and then comes to the third ventricle, and then comes to the fourth ventricle. Through the meninges it is going to present in the subarachnoid space. Where it is subarachnoid space, in the sense it is in between the layer of subarachnoid space and the arachnoid matter and the pia matter. There it is present. That space is nothing but, that space is called as subarachnoid space. Here it is going to produce inside the ventricle. CSF is going to produce, but where it is going to remain? It is going to remain in the subarachnoid space. Now we will see the speed of production of CSF. However, here CSF will be produced. CSF production will be in the ventricles, and then now we will see the speed. What is the speed of production of CSF? Here CSF production speed is 0.5 ml per minute. 0.5 ml per minute, and then per hour it is 30 ml. 30 ml per hour. Then per day, you can calculate here 24 into 30. You will get 720 ml of CSF. 720 ml of CSF produced by the choroid plexus per day. Here per day, how much CSF production is there? That is 720 ml. 720 ml. This 720 ml of CSF is produced by the choroid plexus inside the ventricles, and then that is goes to the third ventricle, that communicates to the third ventricle by the interventricular foramina, and then that comes to the fourth ventricle through the duct that is called as cerebral aqueduct, and then through this medial foramina it drains through the medial foramina and reaches the subarachnoid space through the meninges, and then in subarachnoid space there is a subarachnoid space, there is an arachnoid villi. Arachnoid villi is present. Then what it does? Why it is present? What is the function of this? Arachnoid villi is there. It is going to reabsorb 600 of CSF, 600 ml of CSF. It is going to CSF. Then how much remained? Remaining is 120 ml. 120 ml. It is going to present in the subarachnoid space. Constantly it is present. Constantly it will be present in the subarachnoid space. Why it is present constantly? To protect the CNS, to protect the brain and spinal cord from the injury or damage. It is present. That is 120 ml of CSF. Constantly it will be present in the subarachnoid space. This is the normal phenomena. This is the normal phenomenon. But for the babies and neonates, what happens? For them, with the hydrocephalus, with the neurological defect babies, what happens in the sense? Now, you clearly understood the normal phenomena. Now we will see the abnormality. What happens in the neurological defect with the babies? That is, here there may be the more production of CSF, more than normal, more than 720 ml. That is excessive production of CSF. This is the first reason. And then they will not flow, they will not drain gradually because of the obstruction. This is the second cause. And then in the arachnoid villi, there is no proper reabsorption. There is a less reabsorption takes place. There may be no absorption takes place. These are the three causes. Easily we can understand. Easily we can understand if you know the normal phenomena of hydrocephalus. Next we will see the definition of hydrocephalus. Here, hydrocephalus is the abnormal accumulation of CSF in the intracranial spaces. There will be the excessive production of CSF in the intracranial spaces, in the ventricles, inside the ventricles. And then it occurs due to imbalance between production and absorption of CSF. There may be the production and absorption. They may be varying in the production and absorption. There will be the more production and lesser absorption may take place. And then CSF, due to obstruction of a CSF pathways, there will be the obstruction of the CSF pathway. That is, pathway means how CSF flows through the brain, that is in the ventricle, that is in the two lateral right and the left ventricles, and then third ventricle, and then fourth ventricle, and then medial foramina to the subarachnoid space. This is the pathway, as I told earlier in the introduction part. This is the pathway. There will be the obstruction. In that pathway there may be the obstruction. Due to that, this flow is obstructed. There is no drain gradually. It will not flow gradually. And then it results in the dilatation of cerebral ventricles and enlargement of head. There will be the dilatation, enlargement of cerebral ventricles. Due to the cerebral ventricles enlargement, there may be the enlargement of head. There will be the enlargement of head due to the enlargement of the cerebral ventricles. This is definition of hydrocephalus. Next we will see the types of hydrocephalus. Types. Here there are two types. One is communicative hydrocephalus, and then another one is non-communicative. One is communicative hydrocephalus and then another one is non-communicative hydrocephalus. Here name itself suggests that communicative, in the sense non-obstructed. It can flow, it can drain easily, gradually. CSF that can communicate from the one ventricle to the other, that is non-obstructive one. Here first thing is that communicative hydrocephalus is a non-obstructive one. CSF can't move, can't go from one ventricle to other ventricle through the aqueduct and then foramina. Why? Because obstruction is there. Non-communicative in the sense obstructive one. It is an obstructive one. Rukawat hai. And then here there will be the increased production of CSF. What happens here? Increased production of CSF and decreased absorption of CSF. These are the types of hydrocephalus. What happens here? One is communicative and another one is non-communicative. Communicative means it's a non-obstructive one, and then non-communicative means it's an obstructive one. Obstructive one. And then here there will be the production of CSF. There is an increased production of CSF and then decreased absorption of CSF. Only the thing you have to remember, there are two types of hydrocephalus. One is communicative and another one is non-communicative. Communicative in the sense there is no obstruction. That CSF in the pathway easily communicate from one ventricle to the other. In non-obstructive there is no communication. This is a non-obstruction one. Rukawat hai, there is non-communicative. This is all about the types of hydrocephalus. Next we'll see the causes here. Causes for hydrocephalus. In that first cause is it's a congenital one, and then first cause is intrauterine infections. Intrauterine infections mainly rubella, cytomegalovirus and toxoplasmosis. And then congenital brain tumor, intracranial hemorrhage, there will be the bleeding in the cranial nerves or the cranium, and then congenital malformations. After malformation of arachnoid villi present in the subarachnoid space, arachnoid space. That is in between the arachnoid matter and the pia mater. That is malformation will be there. And then inflammation, trauma, connective tissue disorders like Hurler syndrome, achondroplasia, and then degenerative atrophy of brain. Here degenerative atrophy of brain in the sense there will be the loss of brain cells or there will be the loss of connection between the brain cells. And then arteriovenous malformations, artery and veins malformations, abnormal artery and the veins will be present, and then ruptured aneurysm. Aneurysm is nothing but there will be a bulge or a swelling of a blood vessels. Here ruptured in the sense it's going to release the blood in the subarachnoid space inside the brain. That is ruptured aneurysm. Next we'll see the clinical manifestations. First and foremost, and usually large head will be present, and then a rapid increase in the size of the head. Rapid means continuous, a continuous increase in the size of the head, and then a bulging fontanelle on the top of the head. Fontanelle means where two or more sutures meet. That is fontanelle. Here fontanelle will be swelling. And then McVan's sign. It is one of the sign to detect hydrocephalus. There will be the what they are going to do there in the sense there will be the percussion on the top of the skull at a particular point to add a ultrasound resonant sound in the case of hydrocephalus. That is McVan's sign is nothing but they are going to tap on the top of the skull. And then eyes fixed downward. That is sunsetting of the eyes. And then shiny scalp vein with prominent scalp vein. Shiny scalp, and then there will be the visibility of scalp vein. And then poor feeding, seizures, deficits in muscle tone and strength. Muscle tone is nothing but a quality of muscle and strength. Deficits decreased, and then vomiting, sleepiness, and then irritability will be present. These are the clinical manifestations of hydrocephalus. Next we'll see the diagnostic evaluations for the hydrocephalus. First and foremost there will be the history collection and the physical examination, and then positive trans-elimination of the infant head. Here trans-elimination, that is the shining of a light through the body area or organ to check the abnormalities, to check for the abnormalities. That is trans-elimination of infant head. And next, typical cracked pot sound. Typical cracked pot sound of the skull bone here. That is, as I told earlier, I have explained earlier in the clinical manifestation, that is McVan sign. McVan sign, that is typical cracked pot sound of the skull bone. And then MRI, CT scan, and then cranial ultrasonography, USG of cranium, and then cranial nerves, and then X-ray of a skull, and then lumbar puncture. Here spinal tap. We are going to draw the CSF for the lab testing. That is lumbar puncture. These are the diagnostic evaluation for the hydrocephalus. Next we'll see the management for hydrocephalus. First we'll see the medical management. Here medical management includes osmotic diuretics and the loop diuretics to reduce CSF production. Here these are the types of diuretics: osmotic diuretic and then the loop diuretics. What is the action of diuretics here? To increase urine production and then removes water from the body. But here medical management is temporary. Main management is surgeries, surgical management. Next we'll see the surgeries, surgical management. First one is endoscopic third ventriculostomy. Here stomy means opening or making larger. Here endoscope is an instrument. Third ventricles is going to make a large to pass the CSF. That is endoscopic. Through the instrument, third ventricle is making larger. Stomy means opening or making larger. Ventriculostomy. Stomy means making larger the third ventricle using the instrument endoscopy. And then next is choroid plexectomy. Ectomy means surgical removing. That is surgical removal of choroid plexus. That is choroid plexectomy. And next, ventriculoperitoneal shunt. This is also known as VP shunt. Shunting is nothing but a transfer from the ventricle. Ventricle means brain to the abdomen. There will be the creating a passage. That is transfer. What is that to transfer? CSF. Excess CSF will be transferred. And then here ventriculoatrial shunt. Again it is transferring from the brain to the atrium, that is into the heart. And then ventriculopleural shunt, transferring of the CSF from the brain into the pleural cavity. And then next, last option, this one is the last option. If this won't work, that is ventriculo-gallbladder shunt. That is transfer of CSF that is present in the brain inside the ventricles, that is transferred into the gallbladder, that is to the kidney. Into the gallbladder to the kidney. This is ventriculo-gallbladder shunt. This is all about the medical management of medical and surgical management of hydrocephalus. I hope you all are clear with the topic. Don't skip. If you skip, you will not get a mind mapping. What I have explained in this topic. This is a very, very important topic for all competitive exams. Thank you for watching, and then don't skip. Watch full video till end. From the beginning till end you watch, and then don't forget to like, share and subscribe my YouTube channel. Thank you.